Chuck, on top of all of the COVID-19 concerns in our state, Indiana is now reporting our very first case of a strange illness that's now linked to the coronavirus, and it's causing some very serious health complications in children across the state. Tonight, our Emily Longnecker tonight warns and shares the warning from Riley doctors to protect Hoosiers of all ages.
It's called multi-symptom inflammatory syndrome, and it can show up in children weeks after they've had COVID-19. Indiana now joins more than a dozen other states with at least one case. The announcement came at the governor's Monday briefing.
This is a very serious condition which is similar to what we call Kawasaki's disease.
Like Kawasaki disease, named for the Japanese doctor who first described it in the 1950s, this condition involves the inflammation of several organs.
It's a serious problem, and no question about it. Some children have got really sick with this condition, and some children have died of it.
But Dr. John Christensen, Riley's medical director of infection prevention, says while they see about 25 patients a year with Kawasaki disease at Riley, multisystem inflammatory syndrome is much rarer.
This is not something that even if you had COVID, it doesn't mean that it's going to occur.
Still, Dr. Christensen says it's important for parents to be aware of the symptoms, even if their child never showed any signs of the COVID infection.
And it's very important to keep an eye on any abdominal pain, belly pain that is very abnormal, vomiting, and respiratory problems. And if they're having fevers that are not controlled with Tylenol or some other medication, that they have inflammation that involves multiple organs, they have some inflammation involving their heart, but there was no strokes, there was no heart attacks. Some of these children develop respiratory difficulties, and this child had that.
The good news, the child at Riley responded to treatment to reduce the inflammation. And while Dr. Christensen says we could see more kids develop the same condition with more cases of COVID, his bigger concern is infected kids that could spread COVID to more vulnerable adults.
They're going to be spreading it to adults, okay? And they're going to be spreading it to grandpa, and they're going to spread it to grandma. And they're the ones that are more likely to have complications and are more likely to die of it than any child.
The first child diagnosed here in Indiana started out in the ICU unit at Riley Hospital for Children. Doctors say that child is now out of the ICU unit and getting better. No word on when they could be released.